10 early warning signs of heart attack you shouldn't ignore. A heart attack can be sudden and devastating, but our body often sends us signals that it is about to happen or is just starting. Do you know how to recognize these warning signs of heart attack that should never be ignored? According to the World Health Organization, cardiovascular diseases are responsible for the highest number of deaths annually across the planet. Heart attacks are present in many of these incidents. That's why knowing each of these warning signs could save your life or the life of someone you love. But before we start talking about the signs, do you know what a heart attack is? A heart attack, also known as a myocardial infarction, happens when a part of the heart does not receive enough oxygen due to blockage of one or more coronary arteries. This can be caused by blood clots or the accumulation of fatty plaques. Before it happens, the body probably sends some warning signals of heart attack, especially the 10 signs on the list we prepared. If you recognize any of these 10 signs of cardiac problems, you might be only days away from experiencing a heart attack. It's crucial to consult a cardiologist immediately, as any delay can lead to irreversible damage to the heart. 1. Chest pain. Chest pain is definitely the most common and alarming warning sign of a heart attack, but it varies greatly from person to person. Some patients describe their pain as intense pressure, as if something heavy was sitting in their chest. Others may feel a squeezing or crushing feeling that lingers even after they relax. This pain or discomfort may be ongoing, lasting more than a few minutes, or it may go away and return. It is important to remember that chest discomfort might be minor or non-existent in some cases, especially in women. Instead, an unpleasant sensation may develop, which is not necessarily associated with a heart attack and might be misinterpreted as indigestion or muscular soreness. Regardless of how it presents, chest pain is a symptom that something is wrong with your heart, and you should get medical attention right away. Don't ignore these warning signals. Recognizing them and responding quickly might save your life. 2. Pain in other areas of your body. Although chest pain is the most common symptom of a heart attack, it is important to remember that it can extend to other regions of the body or occur on its own. People suffering from a heart attack typically experience acute discomfort in areas other than their heart. Many people are familiar with the occurrence when pain or discomfort spreads to the left arm, but it can also affect the right arm or both. Furthermore, it might appear on the back, neck, jaw, or even stomach. This discomfort can be confusing and lead to misdiagnosis, since patients may assume they are merely experiencing muscular aches, weariness, or indigestion. Minor symptoms, particularly in women, may include jaw or back discomfort. You should be aware that these strange aches might indicate a heart attack in progress. Understanding and identifying the many ways of how heart attack-related discomfort might manifest itself is critical for obtaining early medical attention. 3. Difficult breathing. Another important indicator of a heart attack is trouble breathing. This symptom can occur unexpectedly, with no prior warning and no evidence of physical activity to support it. People who have this symptom describe not being able to take in enough oxygen, feeling breathless, or having to breathe through a very small space. This difficulty breathing may start before the onset of chest discomfort or concurrently with other symptoms. It is critical to be aware of this indicator since it is readily misinterpreted with minor breathing issues or worry. However, when paired with other heart attack symptoms, it is a strong indication from the body that something is amiss with the cardiovascular system. Individuals with a history of heart issues, smokers, the elderly, and those at high risk for heart disease should be mindful of this symptom. If you found this information useful, remember to continue with us to learn more important heart attack warning signals. And if you haven't already, please like this video to help our channel spread this life-saving knowledge to more people. 4. Cold sweat. Cold sweating is a less commonly recognized but just as significant sign of a heart attack. Unlike regular sweating after physical effort or in a heated environment, cold sweat occurs unexpectedly and without obvious explanations. People report heavy perspiration followed by a chilly sensation on their skin, even in cool or air-conditioned situations. This is a classic example of a symptom that is not immediately identified with a cardiac condition. Cold sweating may indicate that the body is fighting something strange. The autonomic nervous system, which controls the body's automatic actions like breathing and sweating, goes into overdrive as a result of the heart's severe stress. It is a warning sign that something severe is about to happen, and you ought not to ignore it. If you get cold sweats combined with other symptoms such as chest discomfort or trouble breathing, seek medical assistance right away, since this might be an early warning sign of a heart attack. 5. Nausea or vomiting. Nausea and vomiting are symptoms that many people do not identify with a heart attack, but they should not be neglected. These symptoms can be particularly misleading since they are shared by many other less serious illnesses, such as food poisoning or a virus. Nausea and vomiting after a heart attack might develop as a result of intense pain or physical stress. Interestingly, women report these symptoms more frequently than men during a heart attack. Nausea can be mild or severe and may or may not lead to vomiting. Some people report experiencing significant stomach discomfort that is not easily relieved. Be aware of these symptoms, especially if they occur in conjunction with other signs of a heart attack, such as chest pain, cold sweat, or difficulty breathing. In these cases, nausea and vomiting are not just symptoms of a digestive condition. They may be signs that the heart is in danger. Sign number 6. Dizziness or lightness in the head. Dizziness or a lightheaded sensation can be an incredibly common warning sign of a heart attack, especially when combined with other symptoms. This sensation can range from slight dizziness to a strong sense of imbalance, making it difficult to stand or move. The cause of this dizziness is frequently attributed to a drop in blood flow, and as a result, a decrease in oxygen reaching the brain owing to impaired heart function. This symptom may develop unexpectedly and be highly alarming. It indicates a problem with the circulatory system, possibly a heart attack, especially if there is no other plausible explanation for the dizziness, such as dehydration or a rapid change in body position. 7. Unexplained fatigue. Unexplained fatigue, particularly severe and without an obvious cause, is also a sign of a possible heart attack. This feeling of extreme tiredness or exhaustion can occur even after adequate rest or light physical activity, which would not normally cause such a level of tiredness. People often describe this fatigue as tiredness that is not relieved by rest or sleep, a feeling of exhaustion that affects your daily capabilities. Even though fatigue can be a symptom of various medical conditions, sudden and severe fatigue without any clear reason, especially when paired with other heart attack symptoms, shouldn't be ignored. This kind of fatigue might suggest that the heart is having trouble pumping blood because of a blocked artery or another heart issue. It's crucial to recognize this sign, especially in individuals with heart disease risk factors. Noticing and promptly seeking medical evaluation for this symptom can be an essential step in preventing more serious outcomes. 8. Heartburn or indigestion. Many patients who have had a heart attack report a burning feeling in their chest or discomfort that simulates heartburn, which was first attributed to eating habits or gastrointestinal issues. This symptom is especially intriguing because the location of the pain and discomfort might be comparable to chest pain caused by heart issues. Notably, heartburn or indigestion caused by a heart attack frequently does not respond to antacids or dietary adjustments. If this pain is accompanied by additional indicators of a heart attack, such as cold sweat, nausea, or trouble breathing, it is crucial to rule out the potential that it is more than just a digestive issue. Paying attention to this unexpected symptom might be the key to getting medical help in time, allowing for early detection and treatment of a heart attack. 9. Unexplained anxiety. Feelings of unexplained anxiety, especially when intense and without an obvious cause, can be an early indicator of a heart attack. Unlike regular anxiety or everyday stress, this sensation might be defined as an overwhelming premonition of doom, a strong fear that cannot be explained by present circumstances. Surprisingly, this kind of worry might indicate a medical problem with the heart. The association between anxiety and heart attacks is not fully understood, although it is assumed to be linked to sympathetic nervous system activity in reaction to an approaching heart attack. This response might cause symptoms that resemble a panic attack. If you feel an unexpected episode of acute anxiety, particularly If it is accompanied by additional symptoms such as chest discomfort, trouble breathing, or a cold sweat, you should take these symptoms seriously and seek medical attention immediately. 10. Palpitations. Palpitations, a feeling that the heart is beating faster than usual, skipping beats, or beating irregularly, might indicate a heart attack. This experience can be terrifying and uncomfortable, making you feel like your heart is fighting inside your chest. Although palpitations can be caused by stress, coffee consumption, or exhaustion, when they arise unexpectedly and are accompanied by other heart attack symptoms, they must be treated immediately. Palpitations may signal a cardiac arrhythmia or other heart disorders that put you at risk of having a heart attack. It is critical not to overlook these symptoms as simple anxiety or the effects of medications. Instead, if you have palpitations, along with symptoms like chest discomfort, shortness of breath, or dizziness, get medical attention right away. This might indicate that your heart is in danger and that you require immediate treatment. Take care of your heart, maintain a healthy lifestyle, and don't hesitate to see a doctor when necessary. Call emergency services and seek medical attention. Time is of the essence in treating heart attacks. The sooner help arrives, the greater the chances of survival. Have you or someone you know experienced any of these symptoms before a heart attack? Leave your comment below. Like and share this video with your friends and family. You could save a life. If you haven't subscribed yet, subscribe to our channel. Also, allow the notifications so you don't miss our upcoming videos. And what will be the next video you watch? I'll leave 2 recommendations here. Your engagement helps us a lot to continue growing. Thanks for watching. See you in the next video.